Hello, everybody, and welcome back to another Provider Trust webinar. I want to start by saying that, like many of you, we are working remotely currently. Today, we're coming from Tennessee, Missouri, and Wisconsin, so we don't anticipate any technical issues, but do appreciate your grace if any of those do come up. But with that, we'll get started. So today, our presenters are Donna Thiel. If this is your first Provider Trust webinar, this is Donna Thiel, our Chief Compliance Officer. She has 30 plus years experience as a compliance officer with long-term care facilities, some of the largest in the nation. And this is Tim Ridgway, who really is one of our thought leaders in the HR segment and has just been really helpful for HR professionals across the nation. So this is really the perfect tag team to really cover today's topic. So I want to start by saying we know that currently your biggest priority is caring for patients given today's climate, and your bravery and commitment is admirable and so appreciated by us at Provider Trust. But we know that we can't be there to help you get the tests, the masks, the ventilators that you need, or to manage those issues that do arise on the front lines. But what we can do is tell you everything that you need to know to navigate this changing environment. We are going to talk today specifically about interstate license monitoring and how that directly correlates to telehealth delivery and how that is starting to change for all of us. I want to finish by saying, please let us know if there are any ways that we can help you all. We are committed to doing anything that we can to support you. So please just reach out to us if you need anything or if we can help in any way. A little bit about Provider Trust. We are in Nashville, Tennessee. We are a software as a service company, and we work with we have partners in Tennessee as well as across the nation. Some are on the call today, and it's great to see those familiar names. But that is, Nashville is where we call home, and we've just been so lucky to be here over the last 10 years. So Provider Trust, we believe that a smarter healthcare, a smarter healthcare makes a safer healthcare, and we live this out by monitoring healthcare populations to identify compliance and credential issues before they impact patients. So before we get into today's agenda, I just want to let you guys know this is a 30-minute presentation that is pre-approved for CEUs. That will be 0.6 CEUs from the Compliance Certification Board of HCCA. So this afternoon, you will receive a copy of the slides as well as a recording of today's session and your CEU certificate. So please be on the lookout this afternoon. There's also a survey after the webinar today. We just want to continue to add value to your lives where we can and bring you the things that you want to know and the things that you want to learn more about, and we just want to help where we can. So please take the time and fill out those surveys at the end just so we can continue to get better and bring you the most relevant topics that you guys really want to learn about. So today's agenda, we will start by talking about telehealth and COVID-19, how the recent virus has affected the telehealth processes that we're all experiencing. Then we'll follow up with state licensing board updates. Then we will move into telehealth credentialing and the nuances of that. And then finally, we will wrap it up with some comprehensive credential and provider monitoring practices that you can put in place at your organization just to make sure that all your bases are covered. So with that, I will kick it over to Donna Thiel.
Thanks, Matt, and welcome everyone. As this slide says, the future is happening fast. For those of you who participate in the Provider Trust webinars every month, you'll know that this was a topic that was on our roadmap for this month. We certainly had no idea when we had this item thinking about telehealth that our country and our world would be dealing with the coronavirus and all of us working remotely and doing things that we never expected to be doing. So We appreciate your grace as we go through this webinar today. Everything is changing by the minute. Our 30 minutes together today, I think, are going to go by very fast as well. Some of our slides, you're going to see that we've even changed some of the slides as of this morning because the information is changing so quickly. For all of you who are compliance officers, compliance professionals that are on our call today, we know, as well as our HR friends, there is no handbook, right? There's no work plan for the challenges that each of you are facing today in the ever-changing healthcare space. And as Matt said, we absolutely appreciate and recognize that all of you that are taking care of our patients are truly our heroes in our eyes. And we want you to know how much we greatly appreciate the work that you're doing and putting yourselves in harm's way, taking care of our patients. We know that this isn't your number one priority and greatly appreciate that you're here with us today. And as Matt said, throughout our presentation today, we'll be asking you multiple times how we can help. And in the questions box, if there's anything that you think of throughout today, please feel free to put it in there and Matt will capture that. We have a current client who already reached out to us this week and said they had a need for tracking the measurements of their N95 masks and how could we help them. And we've already pivoted to be able to do that this week to help them within our tool, create a way for them to track that. So we absolutely want to help you in any way that we can. So let's get started today with our presentation. First and foremost, thank you. Go ahead, Matt, that's fine. We're gonna just thank you again for being our number one healthcare heroes. Our topic we're gonna start with is really telehealth and COVID-19. On the next slide, we're gonna, oh, sorry, I forgot, we're gonna start with a polling question. Matt, you wanna kick us off with this polling question? Oh, I can't, there we go.
Sorry about that. Yes, this is our first of 4 polls, and we'll share the feedback that we get after these. We'll just leave them open for about 20 seconds just to really get a good read of our audience, and then let you know what your peers have to say. So our first question is, are you actively using telehealth services for your patients? And we'll leave that open in about 5 more seconds. We'll go ahead and close and share those results. So 33% of you have been doing this for more than a year. That's kind of what we expected. Really about a third of you guys should really be ahead on this and have something implemented. About 10% have, yes, they have had telehealth services going for about 6 to 12 months. And then 36% have just started with the recent changes. And you're not too late. Now is such an important time, more than ever, really, to get these telehealth services going. So kudos to that 36%. And then the 21% will try to convince you to maybe take those first steps and get that going for your organization.
Thanks, Matt. So as we get started, we're going to go through kind of the state of the state, if you will, of what we've been seeing. So if you think about this, on March 6th, President signed into law an emergency $8.3 billion spending bill that would really allow the Department of Health and Human Services to just lift some restrictions and give them the leeway that they needed in order to allow the healthcare industry to pivot and do the things that they needed to do. As I was thinking about this slide, I was thinking about what I was doing on March 6th and thinking about how 19 days later, I'm in my home. I live in the state of Wisconsin. We instituted yesterday a safer at home declaration for the next 30 days. And on March 6th, it was a Friday. I'd just gotten home from the long-term care and the law conference, getting ready to participate with a bunch of friends in a chili cook-off. And I think about what we've done in the last 19 days, and all the conferences have been canceled. We are all working in ways that we never thought we would. I think it's just important for us to realize how quickly everything has happened and give ourselves grace for how quickly we're changing on a day-to-day basis. A couple of things I want to highlight about this initial $8.3 billion spending bill that I thought was interesting and really I guess, surprised me when I delved into it a little bit more. We know it's a lot of dollars, right? But for example, $2.2 billion were allocated to the CDC until or through 2022. So when you think about that, we're giving the CDC for the next 2 years monies to deal with the coronavirus. The National Institute of Allergy and Infectious Disease was given $836 million through September of 2024 to prevent and prepare and respond to the coronavirus. The Public Health and Social Services Emergency Fund was given $3.1 billion to remain available until September of 24 to prevent and prepare and respond to coronavirus domestically and internationally, to work with manufacturers in purchasing vaccines, diagnostics, medical supplies. So what was so, I guess, enlightening to me is the realization right off the bat that this isn't just a today situation. These are monies that are being allocated for many years to come and how we're going to be responding to this particular coronavirus. Then if we move on to the next slide and look at what happened just a few days later, right? Just a week later, now is a national emergency, which allows then the hospitals and other healthcare providers to implement their emergency preparedness plans. It gives them waivers to respond more quickly. It really starts to ease that interstate license requirement. And Tim's going to go through the second half of our presentation today and really talk a lot more about the license requirements and how that's helping in the telehealth world. And even on this slide, when we talk about what's next, I think what next means like what happens 15 minutes from now, as opposed to what's going to happen a month or a week from now. When we talk about patients using electronic care, we're all being told each and every day to utilize telehealth. Don't go to the doctor's offices. We're talking about routine visits now where physicians can just give their patients a call on the telephone, not even with video, to check in on them for routine visits and be able to bill for that as a telehealth service. It's just really exciting, I guess, in my mind, how we're really looking to care for our patients in new and unique ways in such a short order. Our next polling question, Matt, do you want to cover this?
Yes, so our second of 4 polling questions here is, with the recent waivers, are you able to effectively meet your patient telehealth needs? So we're just curious of how confident you all feel with your organizations and your current processes in place. Again, we'll leave these open for about 20 seconds to get a good pulse on the audience today. Great, so we'll go ahead and close that and share. So that's great. Most of you all do feel, excuse me, that with the recent waivers, you are able to effectively meet those patient telehealth needs. And for the 32%, we are here to help, again, in any way we can. So just continue to let us know, and we will we'll be in touch with best practice.
Thanks, Matt. So one thing I just want to point out on the slides, that everywhere you see a blue or underscore, those are active links. So when you get these slides later today, you'll be able to link to the resources that we've highlighted throughout the presentation. So I'm going to just say that now so that I don't spend quite so much time talking about each one of these slides, recognizing that we only have a half hour together today. So this particular waiver is important. I think it comes from the Office of Inspector General. So especially for those of us in the compliance world, we're always concerned with any areas where the OIG is going to scrutinize the activities. And this particular waiver allows us to reduce or waive cost sharing, right? Really being able to make sure that we can use telehealth and the doctors can do the things that they need to do to take care of our patients. And you can read this waiver when you get the link. The next slide talks about the CMS telehealth toolkit. And I think this came out over the weekend, if I remember correctly, or at least for me, I read it over the weekend. It really gives some great recommendations and ways for providers and to leverage the telehealth visits, talk about those virtual check-ins that I just mentioned. What are the e-visits that we need to do? And I think as we continue to see toolkits coming from CMS, the more information that they're giving us, hopefully is allowing us to feel more comfortable and confident that the protocols that we're putting in our organizations will go without scrutiny by CMS. Let's go to the next one and we start talking about scrutiny and oversight. HIPAA is always at the top of our minds, and our patient privacy and security, and making sure that we're really taking into account our patient needs. This is one from the Office of Civil Rights where they're saying to our practitioners, we are going to relax some of those requirements. We're not going to require explicit technology to have the telehealth visits. We're going to allow you to use Skype or FaceTime, things that were never allowed under the previous telehealth requirements. They're also allowing our practitioners to use their judgment and serve their patients wherever they need to. So if I'm in a public location, but I have to take care of my patient, I can do that and recognize that it might not be the best of the best HIPAA standard, but from the Office of Civil Rights perspective, not something that they would impose penalties. Again, I think an important thing for us to remember. So unfortunately, as we talk about the good that we are all doing in the healthcare space and everyone trying to meet the needs of our patients in the most expeditious way and safest way possible, sadly, there are always bad actors that we see in this environment. The next couple of slides that we have are just some highlights and some good reminders, I think, for us to use not only with our patients, but with our staff. So this was a particular warning that was put forward by the AUSA, Edward Rivera, talking about potential fraud schemes. Certainly businesses being aware of selling of fake cures, phishing emails, malicious websites, people asking for monies, just fraudulent bills and tests. These are just some examples. And if we move to the next slide, sadly, we're going to see an example of one of those fraud schemes that has already been identified. Just yesterday, the Department of Justice shared the first enforcement action relative to a wire fraud scheme. And these are allegations, of course, but they have shut down this particular website. This particular website was offering vaccine kits, and all you had to do was send $4.95 via your credit card to cover the cost of shipping for this supposed World Health Organization vaccine kit. As we all know, there are no vaccine kits today. So they put a temporary restraining order in and blocked public access to that website. At the top of this slide, you'll see that there's a DOJ alert, an OIG alert, and an OCR alert, which we have linked to that will give you additional information on all of those. So the next two slides, again, are slides that we put together that we thought would be just helpful for you to think about as you're reviewing your vendor partners. You might be bringing on new vendors that you haven't used in the past because you're trying to get supplies from different vendors and you haven't, your current supplier isn't available or isn't able to meet your needs. So just really thinking about who is the vendor that we're working with. Are we looking at their website? Is their email address legit? Doing just a tish more, review of those vendors in this short period of time. Reminding our staff to be very wary of unsolicited emails, making sure that they're looking at those email addresses and that they're legitimate websites. Reminding our folks not to click on any links or open email attachments. These are basic 101 kinds of things, but under the stress that we're all under right now and we're moving fast to try to get things done, we tend to just cut corners, or maybe not even cut corners, but maybe are just not taking the time to really scrutinize some of the emails. So just a refresher for all of us to be wary. And then the last slide, again, is just kind of some best practices that we've kind of pulled from all different sources and our own information, right? ignoring offers for those vaccines or cures or treatment, right? We all know that there is no such thing at this point in time. Checking online reviews of those companies. Again, can you do just a really quick check of the validity of these vendor partners that you're bringing on? As we are all trying to figure out best ways to help support through all, families and friends who are losing their jobs and that sort of thing, making sure that we understand the charities or the crowdfunding sites that we're helping support are legitimate. Again, being wary of anything that's coming through the mail, requesting for payments or donations. Investment opportunities, making sure that we are all participating in kind of the up and up organizations, and certainly seeking out through the SEC. They've put a website together to help us look at information like that as well. So I've talked relatively quickly, tried to kind of get us to a state of the state of where we are today. And Tim's going to take over now and really help us walk through some of the very specifics of the changes in our licensing. Tim, I'll turn it over to you.
Great, thanks, Donna. And I'm going to do the best that I can in the next 10 minutes to consolidate and break down some of the changes that we've seen from state licensing boards and some of the updates that are coming out. So hopefully I can get to most of the content, but I'm sure you'll have questions after the webinar, in which we would love to participate in a conversation on. So what is the first thing that we're seeing, right, when it comes to state license board updates? Well, there's been just significant and rapid evolution and course correction that's being implemented to respond to a lot of the emergency situations that we're in emergencies that are requiring state medical boards to come together and licensing and regulatory organizations to issue joint statements to ensure that the public and the community and the entire ecosystem is well aware of the situation that we're in and their interest in supporting the appropriate care delivery. So expect changes, expect course corrections. There are a number of resources that are available today that do the best job they can to ensure that we are up to date on the licensure waivers and requirements for things like renewals and changes to that. We've got on this slide the Federation of State Medical Boards, who is working to provide updated information on state waivers, consolidating all of that data. But there are many other sources to consider. If you're looking to do a bit more research on your own end, you can look at the National Council of State Boards of Nursing. You can look at the National Association of Boards of Pharmacy and Physical Therapy and Psychology Boards and Occupational Therapy and many others, right? So I think what I took away from this is that there are so many players in this space and market that make it very difficult for an individual or an organization or even an entire system to stay up to date on something as significant as the pandemic and the crisis that we're dealing with. So much so that as we were, oh, sorry, Matt, go ahead. I think we've got a polling question here.
Yes, this is our third polling question. We have one more after this, but we're just curious if to ask you, do the current license board changes make it easier or harder to meet those staffing needs that you all have been experiencing recently? Hopefully it's no difference, because we know that your priorities are elsewhere, and your every day looks different for you guys. So we'll just leave that open for a little bit longer, and then we will close and share. So 39% of you do find it easier, which is great. And then 5% find it harder, and 56% feel that there's no difference. So this is great to see.
Great. I think that the initial interest is obviously to give an opportunity for an innovative care delivery model to take footing and to help do everything that it can to flatten the curve, right? So given the fact that things are evolving so quickly, it's hard for us to keep up with the updates that we are seeing. In addition to, I assume it's similar for many organizations. So as we were creating the presentation and confirming that our facts are facts, we had to amend some of these slides. Because in fact, as of 11 a.m. Central today, all 50 states have made some sort of declaration. So it is important to make sure that not only are you leveraging the resources that are providing information and consolidating the facts, but also you go to the sources directly that are the most appropriate for the businesses that you're in. So as of this morning, there are a number of states in which some of the changes that have been enacted aren't all that visible, right? Unless you go directly to some of the government-sponsored websites. So let's go through just one or two examples of what some of these changes have been, so that you can get some context on how the licensure requirements are being relaxed to help support the necessities of care in today's crisis. So the state of New York has issued a number of waivers that allow physicians and nurses that are licensed in a current good standing from any state in the United States to practice medicine in the state of New York without civil or criminal penalty related to lack of licensure. That alone is quite the statement. As I've been following not only license regulations in general, but the current crisis that we're in, it's just kind of an unprecedented time. So we're seeing some unprecedented measures come across in some of these waivers. Licensees who've registered and are due for renewal or an upcoming renewal will grant an adjustment for continuing education requirements as self-study, which is obviously a big hurdle that's been removed to ensure that we have the providers in place in the places that we need them. And then it also, for the state of New York, permits unlicensed individuals upon completion of the New York Commissioner of Health adequate training requirements to collect throat and nasal swabs for the purpose of testing for the COVID-19 disease. And I suspect that many other states may adopt that or have already adopted that. Something else to think about here is that the Nurse Licensure Compact allows for RNs, LPNs, and VNs to have one multi-state license with the ability to practice in person or via telehealth in both their home state or any other licensed compact state, right? So there have been some significant advancements and changes to those requirements as well. And if you go to the individual state department's websites, for example, Pennsylvania, who was listed on the previous slide as a state that didn't have any changes enacted, actually does have quite a few changes enacted, and they're flowing in every day and frankly every hour. And they're looking at bringing or how to efficiently bring retired healthcare professionals in to come and help bolster the COVID-19 response, and are creating a lot of different variability in waivers, such as some license requirements for qualified physician's assistants have been suspended, and some nursing license requirements to aid coronavirus responses have been waived. So it's not fair to say that all requirements have been waived. For many cases, it's just some and few.
And for the sake of time, Tim, we're going to skip our last poll question here.
Okay, all right, thanks, Matt. So let's breeze through these last two. We're talking about license portability. Obviously, we're trying to flatten the curve through some of these waivers, particularly around telehealth. So what we need to make sure that we understand here, obviously, is that with interstate license restrictions set aside, we're going to give the practitioners the ability to treat patients in really other states, in remote areas, enabling them to scale up their telehealth, their mobile self-care programs, anything that's going to be helpful to reach more people, improve access, and again, to do what we can to flatten the curve. Obviously, state medical boards will still have the authority to regulate the providers. One of the big questions is how long is this going to remain into effect, right? There's been a number of recommendations that suggest that the duration be as long as the declaration of the state emergency, but we will wait and see if that happens. There are a number of challenges to consider. I know we're running out of time here, but one of the big components that I want to emphasize is that as these lax requirements make their way into our daily lives, that we can't forget that these lax requirements will at some point in time end, and that challenges of typical telehealth license verifications will begin to become a part of our normal life. And so there's a lot of variability in how this is being done, contracting requirements with distant site hospitals, latency in data, and a lot of hurdles that need to be managed and worked through. So I think the last piece of the presentation would be, let's continue to make sure that we have a comprehensive monitoring process in place. What we unfortunately see in an environment like today is exploitation exists. And that if there's an opportunity in a behavior to create fraud, abuse, and waste, and essentially harm, that this is an open window in a previously locked home, that a comprehensive provider monitoring platform or process will help continue to keep your health system safe and your patients safe. And then the last thing would be to make sure that as you're thinking about creating a smarter process, you just make sure that you're following a number of different steps, right? To make sure that not only is it adopted, but also that it is efficient. And we've got a number of these listed out here for the sake of time. As you get this presentation, delivered to your emails, you've got an opportunity to just make sure that you're clearly articulating how this should work and how this can work. Obviously, one of the best places to start is to produce processes that reduce internal fragmentation and variability, move to standardize the process across the various teams in a remote capacity, given today's environment. Make sure that there are clear KPIs on performance, make sure that you've got incentives to drive behaviors, understand technology dependencies, any requirements that your teams have, and enabling your team over time will certainly pay dividends. That will be key in designing a strategy. And lastly, make sure that your plan also includes rapid course correction post COVID-19 to ensure that you've got a strategy to sustain retroactivity in any of the licensure requirements that you're going to be held against as these emergency declarations begin to wane. So to end the presentation, I'd love for Donna to step in and discuss a quick message from our colleagues in the space.
Thanks, Tim, and thanks everyone for joining us. And we apologize that we kind of rushed through some of these things. As we've said kind of throughout, we're happy to circle back with each of you. I've seen a number of questions that have come in. Matt will help us disseminate answers for all of those questions, and we will circle back with each and every one of you. So if you have more questions, don't hesitate to reach out to Matt or to reach out to any one of us. So yesterday, I at least received an email as part of a listserv that I'm part of from the CEO of the Federation of State Medical Boards. And it really just hit me yesterday, and I just thought it was an appropriate message and a perfect message to share today. And his conclusion in the email that we received yesterday was, stay well and stay safe, practice social distancing. Thank you for all you do to look out for the public. Remember also to look out for yourselves, your family, your friends, and neighbors. This will end. Let's do what we can to be helpful and supportive of one another. So on behalf of the Provider Trust team, we're here to help you, and we'll be here each and every day to support you as you support the public and your patients. Thank you so much.
Thanks, Donna and Tim. I do just want to wrap up by saying one last time that thank you for spending this time with us today. We so appreciate you and appreciate the role that you are playing in protecting all of us. Please be on the lookout this afternoon for a copy of this presentation, a recording to share with your colleagues or whoever you think may find this valuable, and your CEU certificate. So again, just to echo Donna, thank you from Provider Trust, and we look forward to talking to you soon.